Hi everyone, welcome back again to my channel. My name is Wemimo and I'm also known as ThatMomo5 and also known as TMO5 Kanduko. If you're new to my channel, welcome, and if you're a returning subscriber, thank you so much for always coming back. So you guys, when I saw this news, the nurse in me, the proud Nigerian Glaswegian nurse in me, will not let this story pass. So yes, I've brought news of Nigerian nurses in the UK behaving badly. I've brought news of Nigerian healthcare workers behaving badly who were jailed. I've brought here Nigerian pastors, Nigerian this, that, behaving badly who have been jailed. But yes, I have to bring this story of a Scottish nurse who was caught behaving badly, and we are going to be diving into what the NMC says. In case you don't know what the NMC means, the NMC simply means the Nursing and Midwifery Council. So Nursing and Midwifery Council is a governing body that guides all nurses, all midwives, whatever nursing that you study. As long as you're a nurse, you fall under Nursing and Midwifery Council. So they guide us, they regulate us, there's code of conduct, there's do's and don'ts that you have to follow. And also, for you to actually work as a nurse in the UK, you have to be registered with the Nursing and Midwifery Council in the UK. Either you are from Nigeria, wherever in the world where you've trained from as a nurse. If you come into the UK and you want to take up a nursing job, you have to register with the NMC. And yes, I think we pay £120 every year for us to keep our registration, and then you'll be given a unique NMC pin. Yes, NMC pin. So if you don't have this pin, you cannot take up a nursing job. And you guys all know, being a nurse myself, it's not easy. So nursing degree in the UK takes 3 years, and then you have to do 2,300 hours of work that you are not being paid for. And throughout your 3 years of nursing, you'll be writing essays, you'll be writing exams, you'll be going for clinical placement, you'll be going for training, you'll be traveling miles and miles. And that alone, if you think of that alone, it will not allow you to want to do anything stupid to tarnish that career for you, right? But this our Scottish nurse, I am in Nigeria now, this our Scottish nurse actually did something. And I was like, why did she not know what the NMC said or NMC say in regards to this? So let's read the news. I found it on Daily Record, and I'm going to try and maybe put a screenshot of the news here so that you know that I'm not just forming the story, okay? So the headline says, Scottish, I'll say Scottish, not Scots. Scottish nurse who had Kedewa and secret tryst with mental health patient has been struck off. Yes, that would have been the only thing the Nursing and Midwifery Council would have done. So let's read the story further. So they gave us her name. Her name is Jill McClaren. She's 38 years old. She had secret tryst with a man who was being treated at the secure Glasgow clinic where she worked. Yes, this happened in my own city, in my own Adubo. It happened in my own cache, in my own area in Glasgow here. That's why I said, there's no way I'm going to let this pass. So yes, it happened at a clinic in Glasgow where she worked. So the nurse embarked on a Kedewa relationship with a mental health patient, and she has been struck off by the NMC. Yes, well deserved. Jill McClaren, she's 38 years old. She had secret tryst with a man who was being treated at secure Glasgow clinic where she worked. This included Jill taking the man to her home under the guise of an escorted Christmas shopping trip, which she shouldn't be doing anyway because she is not the assigned staff to do that with that patient. So Jill of Greenock, yes, I know Greenock very well, it's about 30 minutes on the train from where I live, pled guilty to engaging in Kedewa activity with the man at Glasgow Sheriff Court, and I've been in that court several times for interpreting. She was ordered to carry out 180 hours of unpaid work, put under supervision for 18 months, and tagged for 5 months for the crime, which spanned between July 2018 and September 2019. So this happened how many years ago, and they've only just reported this. So obviously they were trying to investigate the case before they finally decided to put the case out there. So her name has also been added to the Kedewa offenders list, and it will be on that list for 18 months after she was sentenced in November of 2023. Jill was hauled before the Nursing and Midwifery Council, NMC, who ruled they had no option but to ban her from nursing. She will never work as a nurse ever again in her life in the UK. For as long as she's been in the UK, she will never work as a nurse. So even if she goes anywhere else, they want to know a record of nursing from where she's coming from. So with that, she will never ever work as a nurse ever again in her life. The court heard that Jill and the man started frequently chatting about their shared love for fitness. That was how they started. She then told the man she started a shift on his word in order to see him, and they began to, flirt with each other. The illicit relationship eventually emerged, and the man's mental health deteriorated after he was made aware that the staff knew about what was happening between him and Jill. He later confessed to his lawyer and staff at the unit, and Jill was arrested. So, at the court blasted Jill for, in quote, a gross breach of trust, and said she had been publicly humiliated for her actions. In a written ruling, the NMC Council said, in quote, the panel determined that the misconduct relating to Ms. McClaren's conviction is very serious and falls considerably short of what is expected of a registered nurse. Ms. McClaren's inappropriate sexual behavior with a vulnerable patient, yes, that patient was vulnerable, and abuse of a position of trust demonstrated deep-seated attitudinal issues. I can't speak English today. In quote, the panel noted that Ms. McClaren has not demonstrated an understanding of how her actions put patients at risk of harm, and what she did was wrong, and how this impacted negatively on her patients, our colleagues, and the reputation of the nursing profession. So that was what NMC said there. So the NMC also concluded that balancing all of these factors and after taking into account all the evidence before it during this case, the panel determined that the appropriate and proportionate sanction is that of a striking of order. See, if I go onto NMC website now and I typed in her name, I'll be able to read all the details of the case there, but it could be hundreds of pages. I don't have time for that, and so I'm reading here for you. In quote, NMC continued that having regards to the matters it identified, in particular the effect of Ms. McClaren's actions in bringing the profession into disrepute by adversely affecting the public's view of how a registered nurse should conduct themselves, the panel has concluded that nothing short of this would have been sufficient in this case. So with that being said, just like I started in the beginning from this video, that if you think of 3 years of nursing degree, you do 2,300 hours of unpaid work. So all this placement that all these student nurses go, they don't pay them. You practically be working the same shift as a full registered nurse. So it varies. In your first year, you will do 3 placements each term. In your second year, you will do 3 placements each term. In your third year, you will do 3 placements each term. So each placement often lasts for 5 weeks. In your final year of third year, you will do a 3-month placement, and I'm telling you, you don't get paid a penny while you are doing those clinical placements. So somebody that has brain, why would you allow an enjoyment of 5 minutes to ruin all of those sweats you went through, waking up to travel to placement? Some, for me, there was a time I was actually spending up to 2 hours on the road back and forth for my placement. So I will now not think of all of those things, and I'll now allow one igbadun ìṣẹ́jú márùn to ruin the career and obviously our years of experience. Also, before we even go further, or before I round up this story, let me discuss with you what the Nursing and Midwifery Council actually say about having sexual relationships with patients. This thing is in our codes and NMC code of conduct. It's there. I remember when I was graduating, they gave us a folder with that booklet of all the conduct that NMC says. And even if you don't want to go about with the conduct everywhere, if you go to NMC website and type in code of conduct, it's there. Forces is there for you. So the Nursing and Midwifery UK is clear about the importance of maintaining professional boundaries between nurses, midwives, and nursing associates and their patients. According to the NMC Code and Guardians on Professional Boundaries, having a sexual relationship with a current patient is strictly prohibited, and I'm sure this nurse knows about it. But she used it to ruin our nursing profession. Key points from the NMC in regards to this. So if you are a Nigerian or you are a sister who is a nurse, and this does not happen to a sister, it's not for sisters alone, also brothers. If you are a nurse, you're a brother nurse in the UK, listen, okay? No sexual relationship with current patients 1. Engaging in sexual or intimate relationship with a patient is considered an abuse of power and a serious breach of trust. 2. It can result in fitness to practice investigations and sanctions, including removal from the NMC register, which was what was done to this Jill McClaren. 2. You cannot even have a relationship with former patients and professional boundaries. You can't. The NMC warns that relationships with former patients may still be considered inappropriate, especially if a power imbalance remains. 2. Factors such as the length of time since that nurse has cared for that patient, and the patient's vulnerability and the nature of the past professional relationships are taken into account. So, if you've looked after a patient before and you're no longer looking after them, it's still not appropriate for you to be in a relationship with them, but these things I've mentioned might be considered for them to say, okay, maybe they'll let that a leeway, but then it's still not appropriate. 3. Abuse of trust and professionalism, and it considers any kerewa, romantic or inappropriate emotional involvement with a patient is seen as a breach of professional boundaries. 2. Even non-physical behavior such as flirtatious communication or suggestive messages can be seen as misconduct. Yes, as misconduct. Number 4. Consequences of breaching boundaries. 1. If a nurse, midwife or nursing associate is found to have had an inappropriate relationship with a patient, they can face 1. Formal disciplinary action from their employer. 2. Investigation by the NMC, potentially leading to suspension or removal from the register, which was what they did to Jill. So they removed Jill from the register. 3. Legal consequences if the behavior is deemed exploitative or abusive. Are you guys hearing? And the last one, professional guidance. The NMC code 2025 states, in quote, you must establish and actively maintain clear sexual and professional boundaries with people in your care, their families and carers. Lastly, nurses and midwives are encouraged to seek guidance from their employer, supervisors or professional bodies if they are uncertain about their boundaries. So if at all you think that maybe a past patient is interested in you, if you're not sure if you're going to be going against the professional code of conduct, that's why it says that you can even email the NMC and ask, or speak to your supervisor. It's better you ask than going ahead and allow enjoyment of 5 minutes to ruin your career for you. Anyway guys, let me know your thoughts and opinion in the comment section. Like I said, we all can learn from it. Like I said, I am a nurse, and me, I will never ever be found in such a mess like this. No. Things will not even reach this one self. I have called out a surgeon before at my work. I have put in a day text to say this happened, this happened, this happened. It's not as maybe I'm trying to be doing a show, but then before you even do stuff like that, speak to your supervisors. You might think, oh, maybe so, obviously because of what you want, it might becloud your judgment. For your judgment not to be beclouded, that will now lead you to where you don't want to go, speak to your supervisors about it, like, oh, this is what is going on. And I'm sure they will either point you in the right direction or tell you straight away, don't embark on it. Anyway guys, let me know your thoughts and opinion in the comment section as regards to what I have said. And if you're interested in any of this nursing code, I will leave the link in the description box and you can go and read it. And if you have any nursing questions, or there's something biting, or you're a nurse or you're a nursing student, there's something in your mind that you want to ask about and you're not sure, feel free to send me a DM. I am on Instagram as thatmama5. And if you don't want to DM me, you think, oh, it's a long talk, you want to send me an email, my email is thatmama5@gmail.com. feel free to send me an email there, or email me as to what you think it is, and if I have an answer, I'll gladly answer you, reply you. If I don't, I might just be able to refer you to something that I found online. With that being said, if you've watched this video till now and you've not yet subscribed to my channel, what are you waiting for? Don't forget to like, drop a comment in the comment section, subscribe if you've not yet done so, turn on your post notifications so you don't miss any videos from me, share this video, and don't hesitate to join my membership, and I'll catch up with you in another video. All right, bye for now. Bye for now.